Good morning, everyone. Myself, Dr. Syed Husan Nawaz Zaidi. I am HOD Community Medicine from Good Medical College. So today we are going to elaborate on topic for very much public health interest, that is accidents and injuries. Why we need to take this topic? Because as we all know, the cases of injuries and accidents are rising throughout this globe. More and more cases we used to see and observe in our mass media channels, televisions, radio, newspapers. So it's a subject of concern. That's why we need to study. And I'm going to take this topic under competency number 8.2, where it's mentioned that describe and discuss the epidemiological and control measures, including the use of essential laboratory tests at the primary care level for non-communicable diseases. So apart from diabetes, hypertension, stroke, obesity, cancer, the accidents and injuries are also being incorporated into non-communicable diseases. So starting with this topic, what you people need to understand as a specific learning objectives. So at the end of lecture, you all be able to understand the burden of the problem, concept of injury and accidents, mechanism and scenario, advocate the prevention of injuries and accidents. So giving a brief about this accident injuries represent a major epidemic of non-communicable disease in the present century. We all know they are no longer considered accidental, they are part of the price we pay for technological progress. Accidents have their own natural history and follow the same epidemiological pattern as any of other diseases, especially non-communicable diseases. That is the agent, host and environment, what we used to learn as an epidemiological triad of disease. So here accidents also fits into that. So together interacting these three, agent, host, environment, and there is a fourth element also, that is vector. When they integrate with each other, then they result into injury or damage. So how we usually measure this problem? What are the indicators? So we may measure through some statistical measures, proportional, like a proportional mortality ratio, number of deaths per million population, death rate per thousand registered vehicles per year, number of accidents or fatalities as a ratio of the numbers of vehicles per kilometer or passengers per kilometer, deaths of vehicle occupants per thousand vehicles per year, etc. So these are the indicators what we usually take to measure the mortality of an area, of a community or nationwide. So morbidity, what we need to take into account, that is in terms of serious injuries and slight injuries. So these two serious injury, slight injury as a morbidity, we assess with the scale that are known as abbreviated injury scale. So we need to remember this. Then comes the disability, measured in terms of temporary or permanent, partial or total. So this is a very much area of concern, because once a person got some injury, it results into mostly disability or daily, that is disability adjusted life years. So some part of the life is being confined to the bed or home. So they usually lose their days of productivity. So that's a concern. So that means disability after injury is a prime concern. It can result in temporary, permanent, partial, total. Now coming to some definitions. First we talk of injury, then we'll go for accident. So what is injury? Injury is the physical damage that results when a Human body is subjected to a brief or sudden intolerable limits of energy. It can be bodily lesion resulting from acute exposure to energy in amounts that exceed the threshold of physiological tolerance, or it can be an impairment of functions resulting from a lack of one or more vital elements, that is air, water, warmth, as in drawing, strangulation and freezing. So the time between exposure to the injury and the appearance of injury is short. So energy causing energy may be mechanical, radiant, thermal, electrical or chemical. Types of injury could be like put under categories like unintentional, that are usually accidental, with intention, that is intentional, that is with just some deliberate attempts. So intentional injuries could be like interpersonal, self-harm, legal interventions by police or other law enforcement personnel, wars, civil insurrections, disturbances, demonstration, riots. And third category is undetermined intent. So it cannot be determined whether it's intentional or unintentional type of injury. So we have global estimates of deaths because of injuries. So we are usually what we observe is that unintentional injuries take a major bulk. Among unintentional injuries, we have more of road traffic accidents, poisoning, then followed by falls, fires, drawing, other injuries. Then comes intentional injuries. Intentional injuries may be self-inflicted, violence, war. So when we come to the accidental deaths during 2019 for India, so we might see that traffic accidents take about around 43% of the total injuries are because of traffic and accidents. Miscellaneous causes accounts for around 20.3%. Then comes forces of nature, accidental fires, electrocution, falls, poisoning, drawing, sudden deaths. Even sudden deaths take a considerable portion, like 11.2% of total deaths. So now coming to epidemiology of injuries, why this injuries happens, what are the forces, what are the risk factors that are being involved in this causation. So we have already talking of host, agent and environment, and in addition I have added one more, that is vector. The host is usually the person injured, agent, force or injury, vectors, the personal thing that applies the force, transfers the energy or prohibits its transfer. Environment will have the situations or conditions under which injury happens. For example, for a road traffic accident, you can say as a motorcycle collision, we have host, vector, agent. The host could be rider, vector could be motorcycle, agent could be collision, mechanical force or injury. Another example could be of interpersonal violence, when a man or woman slaps his or her partner. Host would be the person slapped. Agent, that is the mechanical force or energy or slap. Vector would be the person who does the slapping, and environment would include the domestic situations and the societal norms or values that make such behavior acceptable. So after injuries description, we will go towards accident. So what is accident? So accident has been defined as unexpected, unplanned occurrence which may involve injury. Another definition could be occurrence in a sequence of events which usually produce unintended injury, death or property damage. Types of accidents are many. Most commonly what we have discussed about this proportion among all deaths is road traffic accidents, domestic accidents, industrial accidents, railway accidents, violence. We are much concerned as for the community physicians with domestic accidents like drawing, burn, falls, poisoning, injuries from sharps or pointed instruments, bites and other injuries from animals. So these are the various types of accidents. And then you talk of his causation. What could be the causation that could lead to some accidents? So this is a very complex phenomena. However, it has been tried to be materialized into a matrix known as Haddon's matrix, which says about which discloses how this injury happens or accidents happens. So it is usually divided into three, you can say, events. One is main event when that actually happens, accidents. Then the event before it, that is pre-event, and then the post-event. Here we see what are the conditions that could lead to accidents when we consider humans as a host, vector, physical environment, social environment. So interaction of all these factors. So whether what could be the speed of the vehicle, what are the environmental, physical, environmental condition was there at the time of accident, lightning was there, the road condition, the status of individual, whether he is been intoxicated or is under the influence of alcohol. So these all factors have been taken into account for Haddon's matrix. Then we go for prevention of this accidents or injuries. What we usually need to have to consider the prevention strategies for an individual or for a community, for a nation. We need to have basic data collection, basic information. We should have how much is the morbidity and mortality related with these injuries and accidents. We need to go for safety educations at all levels, starting from home towards schools or into the institutions, or the involvement of law enforcement agencies that usually time to time on various occasions they used to give health information, health education regarding prevention of accidents or injuries. Such measures are again taken to head of promotion of safety measures. Various events are being organized throughout the years for special days. Police personnel, traffic police, they usually do certain events. Even they provide sometimes helmets to the non-bearer. Instead of fining them, they provide helmets. So there is a part of promotional safety measures. Or in case of industries, they have various methodologies and then guidelines and SOPs are there so that injuries or accidents should not happen. So that will be taken into detail in our next interactions. Then comes alcohol and other drugs. So this is a major cause of one of the major causes of accidental deaths or mishaps because of the alcohol content above the permissible level, around 0.5% of alcohol. So that is another reason. Then need for a primary care. We should have well structured healthcare institutions, even at ground levels, at the village level. We should have some points where these people from accidents could be considered, could be treated, could be handled with care. Then we have elimination of positive factors, basically environmental factors that surrounds the event when this any mishap or accidents happen. For example, poor lighting, bad road conditions, poor vehicular condition, and then the poor vision due to environmental changes like fogs. So these things could be taken care of. Then enforcement of laws. We have central laws and motor vehicle acts for two-wheelers, four-wheelers, about seat belts, about helmets, about over-speeding, speed restrictions. So there are various laws regarding that, and we need to be abide by those. And then rehabilitation services for the disabilities that happens because of injuries, accidents. So it's a very crippling condition. People they are demotivated and then disabled for either for temporary or for lifelong. So they need rehabilitating services. For examples, when they have got computed for limbs, they can have prosthesis. So that are the simple examples. Then we need more and more stress on research, especially accident research, so that more and much more preventive strategies can be formulated so that we can minimize the injuries and accidents throughout our areas where the more of these accidents happens. So these preventive strategies we could adopt so that we could have accident less areas or injuries or prevention of injuries, especially domestic injuries, so that our children and women or elderly people be yet safe at home. So all these prevention strategies can be then categorized into three levels, that is primary, secondary and tertiary. So primary levels of prevention, when we talk, when it involves preventing the event from occurring or preventing it from leading to injuries. Primary prevention measures might include putting protective barriers around fires, discouraging people from smoking in bed, and wearing protective gear while working or participating in sport. Secondary prevention we talk of, it talks of involve early diagnosis and appropriate management of injury. For example, applying basic first aid at the scene of incident to stop an injury from having more serious consequences. So that is the secondary level of intervention. And tertiary level of intervention, we improve the final outcome. Example, rehabilitations. More robust rehabilitations involve preventing further complications in the form of more severe injury, disability or death. Example, giving the injured person crutches or a cane or limb prosthesis. So that's all for when we talk of a brief discussion about accident injuries, what could be the reasons, what could be the strategies for prevention, and what could be the laws that is to be taken into account to minimize the sufferings of people and motivate them to be safe on home, be safe on industries, be safe on the roads. So thank you so much for this topic of interest for nowadays, that is accidents and injuries. Thank you.